February is American Heart Month, a time to focus on heart health. Heart disease is the leading cause of death in America. Graham Lee joins us now. Graham?
Well, Brad, the CDC estimates one person dies every 34 seconds from the disease. So we spoke to a cardiologist at Doctor's Hospital today to learn more about the impacts and important things you can do to stay heart healthy. Data from the American Heart Association shows in 2025, nearly 700,000 people in the U.S. died from heart disease. Dr. Fayez Rahman says we're also seeing the impacts in our area.
1 in 3 deaths in the state of Georgia is related to cardiovascular disease.
Seniors 60 have the highest risk of heart disease, but it can show up in younger adults or those with a family history. The most common symptoms are chest pain, shortness of breath, and fatigue, but it can be different in some cases.
Particularly elderly women, if they may come in with a mental confusion state. They may come in with a fall at home, and when they come in, we find that they actually have the fall occurred because of a heart problem.
Doctors say the best prevention methods are making small changes in your routine, especially when it comes to your diet and the amount of sleep you get every night.
Inadequate sleep can lead to increased blood pressure, which is one of the risk factors for developing heart disease later on, and can also lead to weight gain, which is also one of the major risk factors.
He says it's also important to check in regularly with your physician.
Because number of times we see patients who have not seen a primary care physician for years. So they need to hook up with a primary care physician.
Of course, exercise is the other key prevention method, as doctors say you should be doing it for at least 30 minutes most days of the week. They say setting small fitness goals to start and going up from there is the best thing to do to see long-term success. Brad?
Graham, thank you.